Ed here, special edition of Ed Talks, and I have my friend Courtney Bugler. Courtney, welcome to Ed Talks.
Thanks so much for having me. I'm excited to have a chat with you today.
Yeah, so this is really important. We're going to talk about men's health and prostate cancer specifically, and you are the president and CEO of Zero Prostate Cancer. Tell us a little bit first about you, and then I want to dive into Zero Prostate.
Sure. And I'm sure you're sitting here going, why are we talking to a woman about men's health? So that's probably question number one. But a little bit about me. I originally got into nonprofit work because me, like many people who get involved in a nonprofit, whether it's professionally or as a volunteer or going to do a run walk, I was personally impacted. So I'm an almost 20-year breast cancer survivor. And through that, it sort of changed the dynamic of how I looked at my life professionally and personally. And through that, I spent a lot of time working professionally in breast cancer organizations, first for a woman's organization for young people affected by breast cancer. And then eventually at Susan G. Komen and a few others. And one of the reasons that brought me here to Zero is I have a dad who's living with prostate cancer. And I tell the story all the time about how for many, many years, as I was going through my own survivor journey, my dad was right alongside me, running, biking, writing checks, raising money, offering his pro bono services. And when this opportunity came up, I reached out to him and I said, hey, Dad, this makes me feel like this is something I could do. And his first reaction was, what do you need from me? Am I going to need to run or raise money or whatever? And I looked at him and I said, Dad, no. This time I'm going to do this for you. So I came and I joined Zero in part for my dad, but also because it's a disease that impacts just as many men as breast cancer impacts women. And I was hired here at Zero from our board to basically bring that sort of fire of the pink ribbons over here to the blue.
Yeah.
And it's an amazing opportunity with so much potential to save and improve lives. And that's why I'm here talking about men's health with you.
Yeah, no, I love it. It's a great story. We're glad as a prostate cancer survivor, myself, glad you're here and providing that leadership and that passion and all that experience. And yeah, so we want to talk a little bit about that because prostate cancer has this really negative stigma with men, right? Because it's so personal. I mean, it's like, it's my junk, it's like, man. And so they don't want to talk about, they don't want to get screened. If they get screened, they're going to kind of ignore it. So tell us a little bit about what Zero does in the industry to help around prostate cancer.
Sure. So Zero is the largest patient and survivor-focused organization dedicated to prostate cancer in the country. And we really approach it from sort of four arms in the sense of we're working to raise awareness. And you hit the nail on the head. Stigma is the biggest challenge. And again, if I apply what I know from breast cancer, it's almost like we're about 20 years behind. And we're 20 years behind because we haven't yet done what we need to do to remove the stigma around even talking about it. How men and women might see their healthcare is a little bit different. As someone who was just in the car this morning with my almost 16-year-old son, having a conversation about prostates and public health, and my son was like, la, 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 I don't want to hear about it, Mom. But we approach it from awareness, and we do that also to kind of raise the issue, but also remove the stigma. Because the stigma is one of the biggest barriers that we see in not just prostate cancer, but in men's health in general. We do it through support and education. So we do a lot of education for not only the general public, but for also people who are living and facing the disease, both newly diagnosed all the way through people who are living with advanced disease or people who are long-term survivors and their partners, care partners, and caregivers. And then we really do some great supportive services. So Zero has the largest network of prostate cancer support groups in the country, both virtually and locally for all different kinds of groups. If you need to talk to people in a sort of safe environment that helps you feel comfortable about sharing it with people who get it, Zero has a group for you. And then we have a whole arm that's dedicated to advocacy and public policy. If you were to describe kind of the system that we all work in with our healthcare, to us, policy is really what makes sure if the road you're traveling is paved or if it's gravel, if it's bumpy, if it's harder. And we're really proud of our public policy work. We're actually at the forefront of driving some of the largest government resources into research, as well as removing barriers to screening, access, cost, and financial concerns. So it's really, if you are at all concerned about prostate cancer and wondering what your risk is, you can come to the Zero website and find that out. If you're just newly diagnosed and you need to know what questions to ask your doctor, you can come to Zero. If you're living with the disease, or if you're struggling with some of those, as you say, they're very personal issues that can sometimes come up related to prostate cancer treatment, there's a great support group for you. And then, of course, we're going to work hard to change the system and to raise awareness across the whole, to make prostate cancer kind of more part of the national conversation, because it deserves to be.
Yeah, no, I love that. And like I said, so thankful that you're there in a leadership role and Zero is there to support. And we'll put all that information, also the website and things like that, in the show notes so people can easily access that. How's the prevalence of prostate cancer going? Is it trending? Are we getting better at early identification and therefore treatment? Is it trending down, or is it still like the number one, gender specific cancer for
men?
It
is. And there's the number one incidence in men is prostate cancer, and has been for a long time. It is not the number one cause of death in cancer. That would be lung cancer. But the numbers are pretty similar. The one thing that has changed, however, unfortunately, in the last 10 to 15 years is a couple things. One is, in certain populations, they're being diagnosed younger. So especially if you are at a little bit higher risk, you've got a family history. If you're a veteran, you're at slightly higher risk. And if you are a member of the African-American community, African-Americans tend to be diagnosed younger than white men. So that has changed a little bit. And then the idea, really the thing that kind of drives me, and what is the scarier stat, is in the last 15 years, the number of men who are being diagnosed at the beginning with an advanced disease has actually doubled. And so, it used to be about 1 in 10 men, when you're diagnosed, you are diagnosed with advanced disease, which means it's outside the prostate and it becomes treatable, but not curable. And that number has increased. And there's various reasons for that. But one of it really has to do with screening. And it has to do with some confusion around screening, who needs screening. There's some conflicting guidance around who needs screening. But what that's led to is a decrease in the amount of people who are going to talk to their doctors about whether or not they need that screening. And unfortunately, what we've seen in the last 10, 15 years is that has meant that people are being diagnosed at later stages. And I will say at Zero, that's been kind of a red flag for us in the last couple of years, that we need to kind of move more into the early detection business than perhaps we have in the past.
Yeah, right. Because that's crazy, because the screening isn't that difficult. So we're going to turn this sort of into a PSA, a public service announcement, to encourage the men watching to get screened, and our allies with women to encourage the men in their life to get screening. So what should people do? What's the recommendation?
Right. So if you were to look at some of the guidelines, what we first and foremost are going to tell people is you need to talk to your doctor. So one of the things that I will tell you at Zero, and in men's health in general, that I think is actually the biggest barrier, is how many men or people with prostates are not going to see the doctor regularly. So this isn't just a prostate cancer problem. This is a cardiovascular health problem. This is a diabetes problem. And especially, again, if you're younger. So if you are in those populations, again, family history, if you're a Black man, like you should be speaking to a doctor regularly and talk about your risks. The thing that we do know also is that people are not talking to their family about their family history. So there are far too many people in our community who share that only when they were diagnosed did somebody say, oh, your uncle had prostate cancer, or your grandfather had prostate cancer, or your dad had prostate cancer, and no one in the family knew.
Yeah.
So this is, again, back to the stigma. So one is to be talking to your doctor. It is know your family history. And then really understand, when in discussing with your doctor, your risks and the benefits. I'm also here to tell you that the kind of old way that people got screened for prostate cancer, where there were plenty of jokes about, bending over and coughing, that doesn't really get done that much anymore. It's a blood test.
Right.
So it's a PSA test. It's, sort of whatever stigma is around that, which certainly didn't help either. So what we do recommend is for those who are, for example, if you're a Black man between 40 and 45, especially if you have family history, you should be talking to your doctor about getting a baseline PSA test. If you are a man of average risk, you probably start that conversation around 50. But again, it all depends on some of your backstory. And And I will admit, coming from breast cancer, where the answer is when you're 40, get a mammogram, here's a phone call. By the way, it's your birthday. We've already set up your appointment. This lack of clarity sometimes is really bothersome to me.
Yeah.
But that's because different populations have different risks and there's benefits and risks. But again, as somebody who talks to my dad all the time about his health, he's like, look, I get my PSA. He's living with prostate cancer, but he hasn't had surgery yet. He's being under what they call active surveillance. So the world of prostate cancer treatment has changed too. So it doesn't necessarily mean that you have to sort of, the fear of what might happen has also driven a stigma. That's why early detection is important.
Yeah.
Detected earlier, you have a lot more options, and some of them are not nearly as scary as what you might think or what somebody from 20 years told you.
Yeah, you're right, Courtney. You should be getting a physical anyways, and it's just easy. Part of the blood panel is a PSA. Get it done. And then the other thing I would add to that, because I did all that, and you have to, at the end of the day, you as the person still need to take charge. And so even though my PSA score was climbing and my doctor said, don't worry about it, and made me feel good, it's like, oh, okay, I won't worry about it. Well, thankfully, my wife,
It's okay.
but yeah, thankfully, my wife kind of pushing it, led to the discovery. I was already like at a Gleason 3+4, which is not a good place to be to discover that you have prostate cancer. I could have done something much, much earlier. The story has a happy ending. Everything worked out well. I'm completely cured, but that shouldn't happen. So even if when you're getting the physical, getting the PSA and watching it, you need to take charge and be very proactive in your health.
So I would tell you that this is across one of the things. When I was diagnosed with breast cancer, I was 28 years old, and before screening even happened, too young, all those things. And one of the things that I learned very early on, and I think it's true across all diseases, is your body the best. You have to be your own best advocate. But to your point, it's the people in our lives that can also advocate for us when we can't. And so that's sort of what I would say is kind of my rally cry to anybody here is not only, do you have to push, but if there's somebody in your life, whether it's, again, men, women, any gender, any color, no matter where you live, whoever is in your life, everybody needs an advocate.
Yes.
And it's often those people that can help push, that can help ask the questions when you can't. And one of the things that I'm really proud of here at Zero is for people who may not have that person, right? Who may not have that wife or that partner or that best friend or that brother, whoever it is, for people who don't have that person, Zero can help be that person for you.
Yeah, that's awesome.
But really, you gotta push sometimes. One of the favorite things that a very prominent prostate cancer oncologist, when I first started Zero, we sat down, we had dinner, and we were talking about kind of the interplay of patient versus doctors, and they have different roles. And I'm really proud of the fact at Zero that we are a patient-centered organization. We are the patient voice. Because often in the medical community, that gets lost. But one of the things that he said to me, which really I was like, can we trademark that, put that on a t-shirt, is empowered patients make better doctors. And I was like, yep, you pretty much summed up why I moved into healthcare professionally, is because it is often that patient that pushes. And if something happens, it changes how a doctor will think. It changes how a doctor might treat a patient. It changes how a doctor might talk to a patient. And so every time you might push your doctor or you ask questions or you become that slightly pain in the neck patient, you're also doing it not just for you, but for the people who come behind you.
Yeah, I love that. Oh, that was so profound. I wish, I wrote a book recently for Mayo Clinic and with another colleague of mine, another cancer survivor. And that would have been that'd be cool too.
And we're part of it, right? It's not just doctors and nurses and social workers and case managers. Like we are a part of the healthcare system as well.
Yeah.
And
Right
we
on.
have a role to play, and we probably have more power than we give ourselves credit for.
Yeah. Hey, I love it. Courtney, so great to speak with you again. I'm so glad you're leading Zero Prostate Cancer. And thank you for sharing with us. It was super enlightening.
Thanks so much.